I became interested in studying dementia as an undergraduate student, and I had already had an interest in the lives of older individuals, and primarily because of my grandmother. I think I had a good affinity with her and other older individuals. And then she did develop dementia, probably of the Alzheimer's type, though it wasn't diagnosed that accurately. And so throughout my undergraduate research projects in my graduate school, as getting my Ph.D. in sociology, I focused on how families surround people with cognitive impairment, dementia, and how the healthcare system and long-term care system supports individuals with dementia. The easiest message is what's good for your heart is good for your brain. So research has shown over and over that eating right, exercising are great for slowing down any potential onset of Alzheimer's disease or another type of dementia. They've also shown that using your brain in different ways does make a difference. So it's not just doing crossword puzzles, but developing some other paths of keeping your brain strong. And even social support, that's some of the newer research that shows staying engaged socially is really good for you. And again, that can push off those negative symptoms. For some people, there are certainly college professors who have been running marathons and eating right for years who will still get Alzheimer's disease. But we can push off the symptoms. That's some of the good news. The current project it's a 3-year project that I'm focused on, I'm doing with Dr. John Baker from the Department of Psychology, and they are using behavior analysis to focus on individuals with more challenging behaviors. Maybe they wander, or they yell, or they hit, or they spit, a variety of things that might not go over so well with the staff of a skilled nursing facility or with families. And so we were able to get some funds from the state of Michigan, from the fines that nursing homes pay to the state, and they're funding research to improve care, which I think is an excellent way to use that money. And primarily Dr. Baker and his graduate students, who are trained in behavior analysis, will spend a lot of time with these individuals and the staff who work with these individuals and find ways to modify their environment so that they're less likely to have negative behaviors. So not only will improve the quality of life of the person with cognitive impairment, but improves the life for the families and the staff who surround that person. And it's just taking some time and realizing that these people can learn and they can react and they have emotions. And if we are more sensitive to all that, we can make the environment better for them and improve their quality of life. In the current research project that Dr. Baker and I are working on, we're looking at different things. I am more familiar with organizational change and approaches to quality. He is an expert in the actual techniques of behavior analysis. So I am looking at what it takes in a skilled nursing facility to implement changes. So when Dr. Baker and his team works together and comes up with this great plan, here's what your staff should do, this is a training module, this is how they should be trained. What does that go and sit on a shelf? Do they say, oh, the researchers are gone, this is over? What does it take to make that change actually happen? So that's one of the great things about working together across disciplines. But in my opinion, any teamwork is going to enhance what you do in research. And especially in gerontology, where late life is life and it's pretty complicated. So it's really important to work with others who can enhance your thinking process while you're trying to answer questions.